Hi everyone, hope everyone's doing well today. My name is Dr. Carin Matsushita. I'm a naturopathic physician and registered acupuncturist at Brio Integrative Health Center. Today we're going to be talking about preventing kidney stones. If you know anyone who's struggled with kidney stones or have ever wondered where they're coming from, please share this video. We'd love to be able to provide some support. We will continue to be live most days of the week while we're in self-isolation time. We want to be of service and we want to support you. If you have any topics you'd like us to cover, please let us know. Write that into the comments. We would love to hear from you. All right, so preventing kidney stones. So I know that we don't talk about kidney stones very often, so maybe this topic seems a little bit out from left field, but last week there was a news story going around about Liam Hemsworth, and he's a famous actor. He's famous for being fit and being this picture of health, and for marrying Miley Cyrus. But the story was that he had a kidney stone. If you've heard about this, give me a thumbs up, let me know. And he associated that with his high vegetable diet. And I'll discuss more about what he might have meant by that. So kidney stones are not rare. They do occur in people, including people who are very intentional about their health. Risk of getting kidney stone for men is just under 20% and just under 10% for women. So certainly not uncommon. We all know about, probably heard about passing stones being very painful, excruciating. Liam Hemsworth was quoted as saying that being hospitalized with a kidney stone was one of the most painful weeks of my life, is what he said. We also know that just having the stone and passing the stone can damage the kidney tissue. So there's multiple issues with that. I also really wanted to talk about it today because we can actually get pain and symptoms, tissue damage from the process leading up to getting a kidney stone. Just like we can be affected by blood sugar problems even before we have diabetes, or even if we don't have diabetes, we can get pain and symptoms and tissue damage from the process leading to developing a kidney stone, and even before we get a kidney stone. So hopefully I can clarify what I mean by that in a moment. So my hope is that we can be a bit more proactive when it comes to kidney health and oxalate health. So what are kidney stones, first of all? Kidney stones are actually hard stones or crystals that are in the kidney tract. They might not have any symptoms at all when they're sitting there, but they can have that famous pain when it starts to go through the passageway to the bladder. If any of you have experienced this or have heard about this, you'll just give me a thumbs up and let me know. There are a few different types of stones, and most of them, about 80% of them, are these calcium oxalate stones. And I'm going to try to focus my chat today on the oxalate type, as it's definitely the most common. And even without the stones actually forming in the kidneys, these oxalates can cause problems. So I want to be talking a little bit more about just oxalates in general. So what are oxalates? So oxalates are compounds that we find in plant foods. And in our blood, because our blood pH is about 7.4, the oxalate is in what's called a dibasic form. It just means that it has a -2 charge on it. So that means that it's ready to bind any minerals that have a positive or a +2 charge on them. So this is like calcium, magnesium, zinc, and other minerals. So when it does actually bind with that, then it creates the crystal. And the rate of that crystallization really depends more on the oxalate levels than, say, the calcium. So it's more about how much oxalate there is that would determine how much of that oxalate crystallization happens. So what is it that actually increases oxalate levels? That's really the question that we want to ask. For sure, diet is our largest exposure to oxalates. We actually eat oxalates, again, coming from plant foods, fruits and vegetables, nuts and beans as well. Also, yeast in our body, candida, fungus, molds, those kinds of things can actually raise oxalate levels as well. And even less probably well known is a vitamin B6 deficiency can contribute to higher oxalate levels because vitamin B6 is used to actually break down oxalates in the body. There are other causes to enzyme defects and things like that, but these are more of a genetic disorder. They tend to be quite severe, but also quite rare. So beyond the kidney stones, then, how can high oxalates actually impact our health? I mean, that's really the question. If you have a kidney stone, we know that there's some issues that are going to be potentially damaging our kidneys. But what if it's just the high oxalate levels in your body, in your blood? That by itself, those oxalate crystals can cause some issues as well. And most of these are going to come up as pain. Typically, that pain is showing up in bladder pain or groin pain. So this is a recurrent type of pain that where there's no infection involved. So it might maybe look like a bladder infection, but there's no infection. It can also be something like a muscle ache or a joint pain from these high oxalate levels. And even these oxalates can interfere with hormone glands. So even a thyroid function could be involved too. You've probably heard that antifreeze from your car, which is ethylene glycol, is poisonous to humans. And the reason it's poisonous is because it actually affects our oxalate levels. It actually increases them. So very high oxalate levels can definitely be damaging to our health. So what do we do about it? Before I jump ahead, if there are any questions about how the oxalates form or how kidney stones form, do let me know. Please write it in the comments. Be happy to clarify anything. So the big question here is, how do we avoid getting high oxalate levels? How do we avoid getting kidney stones? Is there anything that we can do about it? The one thing that I think maybe sounds obvious, but I don't want to skip because it's really important, is hydration, of course. And generally drinking water throughout the day. I typically recommend about half your body weight in pounds is the number of ounces that you want to drink throughout the day. Away from meals would be ideal. So it doesn't affect your digestion. So good amount of hydration. And then of course, POP has been linked to increased risk of stone formation. So avoiding soda as much as possible is also helpful. So hydration is a big one, a simple one, pretty well known one, I think, but it is really helpful. Now, the next big topic is going to be a diet or what we're eating. So I think, as I mentioned before, the largest exposure of oxalates is coming from our dietary plant foods. So vegetables, fruits, nuts, beans, those, largely healthy types of foods. So in some ways, some people think, oh, maybe I shouldn't eat those kinds of things, but we definitely don't want to cut those out. We know actually that eating more fruits and vegetables reduces our risk of kidney stones compared to eating less fruits and vegetables and eating more animal protein. So it's not just the oxalate amount that we're consuming to consider. There are pH balances and things like that that also help or hinder that risk of kidney stones. So it's important to make sure we keep plant foods in our daily diet. And what I would recommend is definitely choosing a mostly whole foods diet with a variety of fruits and vegetables. So whole foods meaning the least amount of processed foods as possible, which helps us to just keep the salt content down. And then, of course, the variety of fruits and vegetables, because different fruits and different vegetables have varying degrees of oxalates in them. So If one day you're having something like spinach that's a large amount, as long as we're not having every single day in large amounts, we're varying that up. That can be, you can still safely keep all the vegetables in. Liam Hemsworth reported that he was eating 5 handfuls of spinach in a daily morning smoothie. So I certainly don't know if that causes kidney stone, but that is a large amount of oxalates to eat on a regular basis. So what I like to do is when I'm at the grocery store, I always try to buy leafy green vegetables, but I just try to buy different leafy green vegetables. Maybe this time I'll get spinach, maybe next time I'll get arugula, maybe next time kale, and then switch to lettuce, that sort of thing, just to make sure that it's always something different. And I will include a short list of some of the the foods that have a large amount of oxalates. I'll just have a little list at the end of the summary or in my notes here, just so, in case you'd like to look at that. And you want to just try to avoid eating a huge amount of those foods every single day. And of course, this is going to depend on just how high your risk is. If you've already had kidney stones, then you want to be a little bit more careful about how much oxalates you're consuming. But generally, a whole foods diet with a variety of different rotating vegetables and fruits works for most people. One of the things that I do hear about, any questions so far, let me know. One of the things I hear about is when somebody hears that it's a calcium oxalate stone, sometimes I hear that, oh, maybe I shouldn't be eating any calcium. And so I want to clarify that a little bit. We definitely want to continue to eat calcium-rich foods. So most of those are going to be coming from vegetables or dairy. And you definitely want to keep the calcium in. We actually know that the higher amount of calcium or the adequate intake of calcium actually reduces your risk of high oxalates or reduces your risk of forming kidney stones. So definitely a calcium deficiency can actually make stone formation risk worse. So definitely keep the calcium-rich foods in. That can actually really help. In your gut, the calcium and the oxalates together will actually bind. This is in your gut. So that will actually help the oxalates to not get into your blood and increase the levels there. So certainly keep the calcium in, and that'll actually help reduce the risk of kidney stone formation. If you have kidney stones or have been told you have oxalates in your urine, so if you have a history of kidney stones, you know that you're already at a higher risk of getting another kidney stone. But some of us actually have been told that we have oxalates present in our urine. So this would be something like in a routine urinalysis, in the urine microscopic part of that urinalysis. Sometimes it just says calcium oxalates present. I've seen this just in a routine review of Life Labs tests for my patients. It's not even something that my patients often know about. I just see that it's there. So sometimes you'll see that in the oxalate, in the urinalysis. So that'll give a little bit of clue that your oxalate levels might be a little bit higher. For those people, we do want to be a little bit more diligent about the hydration and just making sure we're avoiding the really high oxalate food consumption. But also, if you're already doing those things or following a low oxalate diet, in fact, and you're still getting high oxalate levels, that's when I would recommend going and looking into what's going on with the gut flora. So we had mentioned before, yeast, mold, fungus, those kinds of things can actually increase or contribute to higher oxalate levels also. So that's something that is often hard to pick up just with symptoms. So it's something that we can pick up with specialized tests. Also check for vitamin B6 deficiency. If it's there, it's something that's really simple to replenish, but that can also help to break down the oxalate levels as well and try to and reduce that. Another little tip that I've just recently heard about is that glyphosate, which is the herbicide that's really commonly used around the world, that's the active component of Roundup herbicide. Apparently that can contribute to oxalate levels as well. So that's another reason to try to avoid herbicide in our foods, of course. Organic foods is probably the best option for that. But just avoiding, of course, herbicides, pesticides, Roundup use just in parks and in our gardens and things like that as well. Are there any questions so far? Hopefully that makes sense. All right. So let me just kind of review just some of the things we were talking about. So, of course, kidney stones is something that we want to try to avoid. We don't want that damage. We certainly don't want the pain of the kidney stone. But also the high oxalates that tend to precede kidney stones. That's the part that we also want to watch out for. Because even without the kidney stone, the high oxalate levels can cause issues with body pain, joint pain, thyroid issues, bladder irritation or bladder pain. I've heard some people even have eye pain or pain with bowel movements. So these oxalate crystals can occur and circulate all over the body. So they can cause issues besides kidney issues. So definitely the important things to do right now to be proactive with that is to be hydrating throughout the day, emphasizing variety in your whole foods diet, making sure that we're not getting too much salt coming into the diet, addressing any kind of vitamin deficiencies, especially B6, and then of course that gut flora balance, that making sure there isn't a yeast overgrowth or a mold colonization issue or a fungus issue. Those are really good ones, especially if you've been struggling with this recurrent kidney stone issue for a while and we're wondering what else can you do beyond hydration and low oxalate diet. And I think right now is a great time for all of us to look at what we're doing with our habits and see if we can make any small adjustments, because of course our daily seemingly small habits, but daily are the ones that when we do over time, they're kind of woven together, and that really helps with our health and our resilience down the road. So that's my hope for today, is that we can keep that in mind, that oxalates are going to be part of our diet, and it's okay that they're part of our diet. But hopefully just knowing this information helps to just remind us to keep that variety in our foods, keep us that water throughout the day as well. And also, if you have been struggling with this for a while, let us know. We can help you dig a little bit deeper in what's been going on so that you're not on a low oxalate diet for a long time. So hopefully that was helpful. Hopefully you were able to get some new information from that. We want to provide practical, useful information here. So if there are any other topics that you'd like to hear about, please write it in the comments. We would be happy to hear from you. We'd be happy to address those. Thanks so much for joining me today, and we will see you next time. Thanks. Bye.